Very good evening, and thank you for having me on this stage. It's a big honor for me. Okay, let me share some information with you. In 4 years, we will start to celebrate the hundreds of years discovery of the very first antibiotic, penicillin. On September 28, 1928, Alexander Fleming returned from his vacation to his office in St. Mary's Hospital and found the presence of a mold in one of the petri dish with staphylococcal bacteria. Actually, he could just throw away that spoiled culture. However, he noticed that bacteria are not growing nearby the mold. And he got the idea that probably that mold may produce something that kills bacteria. And that was a great and brilliant idea, because later that substance was isolated from the mold and it was called penicillin. However, penicillin started to be used in clinical practice just in early 40s. And that time it was a really magic drug, which actually changed entire medicine forever. Do you know that life expectancy before penicillin was, even in industrial countries, just 47 years? I'm slightly older, so I'm supposed to be dead already. Yeah. And current report of Malaysian Statistic Agency revealed that life expectancy for babies who born in 2021-2023 is expected to be 74.8 years, so almost twice higher. And that is, of course, largely thanks to antibiotics. So coming back to 40s last century, penicillin started to be used, and it was really a miracle, because few injections of penicillin that time could treat almost any infections. And that time, for example, we could treat pneumonia with penicillin, blood infection, meningitis, TB, whatever. And even, for example, some really serious infections could be treated with penicillin. But what happened later? Can we use penicillin nowadays? Have you heard that we use penicillin widely to treat any infection? Who from you has been prescribed penicillin? I think nobody. And what happened with the magic power of penicillin? Why penicillin lost his actually activity? And the answer is bacterial resistance. What does it mean, bacterial resistance? Bacteria may develop some mechanism to avoid from the action of antibiotics. They have different mechanisms, like, for example, they can produce some proteins, substance that can destroy antibiotics. Some bacteria may change their protein structure, and antibiotics cannot bind to proteins in bacterial cells and kill them. Some of them just pump out antibiotics from their cells. And it is also important that bacteria are very fast divided. So they can divide every few minutes. And in this case, even one single bacterium which change its structure and got resistant ability to escape from antibiotic action may pass genetic information to other generations, making in very short time entire population resistant to the antibiotic. And that's indeed what we can see nowadays. 80 years later, when we start use penicillin in the clinical practice, most of strains of, for example, staphylococci or gonococci are completely resistant to penicillin, and we cannot use it anymore. So magic antibacterial weapon turned into the plastic gun. And unfortunately, it's happened not only with penicillin, it's happened actually with each and every antibiotic. And of course, it has a lot of impact into the healthcare. Like if first-line antibiotic is not effective, we have to use the next one and next one. And of course, it's prolonged the treatment and make this treatment more expensive. In 2023, one paper was published, and it was revealed very interesting information, like mortality rate in the patients with bloodstream infections caused by bacterial resistant strains, 35% bigger compared to that, the same infections in the patient who has no resistant bacteria, 35%. And additional expenses to treat the patients with, for example, again, resistant strain could be about $12,000 more for intensive care unit compared to the same infection patient with no bacterial resistance. The cost of premature death patient with antibiotic resistant calculated currently it's about $130,000 US. So that's what we pay for antibiotic resistance. And that is actually not the worst scenario, because some bacteria may become to be resistant against many different antibiotics, not only one. And we call that bacteria as superbugs. And superbugs is actually, I would like to say it's not it's an unofficial term that we can use to describe any bacteria or probably other microbes as viruses and fungi and some other microorganisms if they are resistant to many antibiotics and antimicrobials that we use in our daily routine medical practice. I give you one example, like methicillin-resistant Staphylococcus aureus, MRSA. This pathogen commonly cause skin infections that we can get just simply by scratching of our hands or gardening or whatever. And if we face infection caused by superbugs, sometimes we almost have any antibiotics to treat. An infection actually untreatable. So the patient again may die because of simple wound infection, similar as it was 100 years ago. And there is one very interesting prediction which made by United Nations Committee on Antibiotic Resistance. This committee released some prognosis that by 2050, the mortality rate, annual mortality rate due to antimicrobial resistance could be about 10 million people a year. Well, you can tell me, okay, if it's so serious, we need just to have many antibiotics, right? That's it. However, guys, you have to understand that if we produce new antibiotic, bacteria will find a way how to escape from this action. And this is like arms race. Humans create new antibiotics, bacteria develop new methods how to escape from their action. And this arms race is actually very expensive. Because do you know that to create new antibiotic, we have to spend at least 10 years of hard work, and we have to pay at least a few $100 million US. Well, what are the reasons, what are the causes of antibiotic resistance, why bacteria become resistant? Actually, one of the main reasons is use of antibiotics. As more we use antibiotics, as more we give chance bacteria to survive, especially if we use antibiotics wrongly. I think many of us, at least once in life, use antibiotics to treat simple cold. However, cold is viral infection, and it could not be treated by antibiotics because viruses are not sensitive to antibiotics. And it's very interesting that recent papers say that after COVID-19, we could see increased number of antibiotic resistance. How it's related? COVID-19, viral infection, and antibiotic resistance. simply because at the beginning of pandemics, we used a lot of antibiotics to treat the patient with COVID-19, just because we had nothing else. We had no antiviral drug specific to COVID-19, and we very commonly used antibiotics just to do something. And currently, of course, even if we know that we should not use antibiotics for COVID-19, but we already got increase in antibiotic resistance. But even if we prescribe antibiotics correctly, how many of us follow all doctors' prescriptions in terms of dose, in terms of duration of treatment? How many of us skip at least 1 or 2 doses of antibiotic or preliminary terminate treatment because we already feel okay, right? So that is why we need to continue the treatment. But even 1 missing dose of antibiotic or any deviation from the doctor's prescription gives bacteria a chance to survive. And if bacteria survive, it may progress and increase antibiotic resistance. Another very important point, the use of antibiotics in agriculture. We never think about it. However, antibiotics are commonly used in livestock farming for growing animals and poultry to prevent infections in farm animals. And in this case, every time when we consume some products, food, we have potentially chance to be exposed to antibiotics as well. And antibiotics used not only to grow farm animals, but also fruits. Antibiotics from agriculture may contaminate soil and water. And again, they can come back to our body with the water, for example. Antibiotics in agriculture may develop resistance strain in animals, and that strains of bacteria may be passed to the humans through direct interaction with the animals or contaminated food. But if we discuss about infection and treatment of infection, we have to remember that the most effective way to treat infection, to prevent infection. And to prevent infection is the best way, just simple hand washing and simple hygiene. Do you know that 3 out of 4 deaths that caused by superbugs could be simply prevented by spending only $2 US per 1 person per year for measures as hand washing? And poor hygiene and poor sanitation is the most common reason why bacteria resistance spread in the hospitals and nursing homes. Another very important preventing factor that we usually do not think about it seriously as vaccination. Because vaccine is the main tool to prevent infections. But how many people they refuse to take vaccination and they do not vaccinate their children? Last but not least, I would like to tell you about global travel. Now borders are open, right? So we can travel again. But when we travel, we facilitate spread of resistant strain across the borders. And that is another reason why bacterial resistance now is a global concern. So what we personally can do to stop emergence of superbugs and progression of antibiotic resistance? Each of you and each of us, yes, can actually, first of all, do not use antibiotics without doctor's prescription. And if we prescribe antibiotics, we have to follow all doctor's instructions. Dose, how often we have to take antibiotics and how long. We should not refuse vaccination if we have no contraindications. We have, of course, increased awareness about the antibiotic resistance. And we have to teach our children, our neighbors, our relatives. And of course, we have to simply wash our hands. Thanks COVID, I think that is one of the benefits, because COVID taught us how to do it properly. And last but not least, of course, regulatory authorities have to look very precisely on use of antibiotics in agriculture and healthcare. So history of antibiotic goes back to almost 100 years. During that time, the use of antibiotic had actually both very breathtaking ups and downs. And nowadays, our aim to preserve the great discovery made by Alexander Fleming 100 years ago, and discovery of other scientists to prevent humanity from returning back to the age before antibiotics. Thank you so much.